Your physician has just scheduled a standard examination. Seems completely harmless, doesn't it? Just a basic screening. Spot any issue at an early stage. Better cautious than regretful. But what if I told you that beyond the age of 70, that simple screening might actually be the most hazardous thing your doctor ever does to you? Not because the procedure itself causes harm, but because of everything that follows. The additional testing, the biopsy, the operation, the complications, the recovery process that your body at 70, 75, or 80 may not be able to endure. Dr. Eric Sanat, my name is Dr. Eric Sanat. I've been working in internal medicine for more than 25 years, and today I'm going to walk you through 5 medical screenings I would never recommend for any of my patients past the age of 70. Not because these procedures are inherently bad, but because beyond a certain stage of life, the calculations shift entirely, and nobody bothers to tell you that. The Cascade Effect, how one test spirals. Before I run through the list, you need to grasp one fundamental concept that changes everything. I refer to it as the snowball effect. Here's how it operates. A standard screening detects something. Perhaps it's a mark on a scan, a number slightly above normal, or a shadow on an image. Now your physician is obligated to look further. That involves more testing, possibly a biopsy. The biopsy reveals something. Now the conversation turns to surgery, chemotherapy, or radiation. Every step introduces its own dangers: infection, hemorrhaging, anesthesia complications, hospital-acquired pneumonia, falls, delirium, cognitive decline that may never fully resolve. And here's what most folks fail to realize. Beyond age 70, many of the conditions these screenings uncover would never have produced symptoms during your remaining years. They would have stayed silent. You would have lived your entire life without ever knowing they existed. That is the snowball effect. A single straightforward test setting off a chain of medical interventions that ultimately causes more damage than the original condition ever would have. Now, let me take you through these 5 screenings. Checkup number 5, routine colonoscopy after 75. Number 5, routine colonoscopy beyond age 75. The U.S. Preventive Services Task Force has clearly advised against routine colonoscopy screening for adults over 75 who have already been previously screened. Yet millions of seniors past 75 continue to receive them every single year. Why is this concerning? A colonoscopy demands complete bowel cleansing, which produces severe dehydration in older patients. The procedure itself comes with a perforation risk of roughly 1 in 1,000. That figure sounds minor until you understand that a bowel perforation in a 78-year-old typically results in emergency surgery, ICU admission, and a mortality rate ranging from 25 to 30%. The benefit side? If you've been routinely screened and your earlier colonoscopies came back clean, the likelihood of developing a deadly colon cancer in your remaining years is exceptionally low. The risk versus benefit equation has reversed. So what should you do instead? If your past colonoscopies have been clear, have a conversation with your physician about whether ongoing screening is genuinely necessary in your particular case. Checkup number 4, aggressive cancer screening, PSA and mammography. Number 4, aggressive cancer screening through PSA testing and mammography. I have to tread carefully here because this is where emotions become intense. Cancer is frightening, and the urge to constantly screen for it feels like the responsible choice. But here's what the evidence demonstrates. For men beyond 70, the PSA test produces a false positive rate close to 80%. That means 8 out of every 10 men with an elevated PSA reading don't actually have clinically meaningful cancer, but they end up getting biopsied regardless. Prostate biopsies cause infections in as many as 5% of cases. They produce urinary complications. They generate anxiety that drags on for months. And among the cancers that do get detected, many are slow-progressing tumors that would never trigger symptoms within the patient's remaining lifespan. Treating them with surgery or radiation produces incontinence, impotence, and a sharp drop in quality of life. For women beyond 75, mammography screening identifies cancers that have an extremely low likelihood of impacting life expectancy. The U.S. Preventive Services Task Force concluded that there's insufficient evidence to support routine mammography after 75. The question you should pose to your doctor is this: if this test finds something, What would treatment realistically look like for someone my age? And is that treatment more likely to lengthen my life or diminish my quality of life? Checkup number 3, routine cardiac stress testing. Number 3, routine cardiac stress testing. Stress tests get ordered as a matter of course for seniors, particularly ahead of surgical procedures. But a cardiac stress test performed on a patient who has no symptoms is essentially hunting for problems that may not even exist. False positive rates in asymptomatic patients beyond age 70 surpass 30%. A false positive result means you now require a cardiac catheterization. That's an invasive procedure where a thin tube is threaded through your arteries straight to your heart. The complications include arterial injury, stroke, heart attack, and kidney damage from contrast dye. If you don't have chest pain, no shortness of breath, no dizziness, and no family background of sudden cardiac death, a routine stress test could generate more problems than it actually prevents. The critical question: am I currently experiencing symptoms that point toward a cardiac problem? If the answer is no, then ask why the test is even being ordered. Checkup number 2, routine bone density scans, DEXA. Number 2, routine bone density scans, also referred to as DEXA scans. Osteoporosis screening sounds harmless, and for women in their 60s, it can offer real value. But for patients beyond age 75, the results nearly always indicate bone loss, because bone loss is a natural part of getting older. The real problem is what comes after the diagnosis. You get prescribed bisphosphonates. These medications have been associated with esophageal damage, jawbone death, and a counterintuitive rise in unusual breaks called atypical femur fractures. For many patients beyond 75, the side effects from the medication pose greater dangers than the fractures the drugs are meant to prevent. And the most effective single intervention for preventing falls and fractures isn't a pill at all. It's physical activity, balance training, eliminating tripping hazards in your home, and making sure you have sufficient vitamin D. Checkup number 1, carotid artery ultrasound screening. Number 1, carotid artery ultrasound screening. This is the one that troubles me the most. A carotid ultrasound searches for blockages in the arteries that carry blood to your brain. It sounds essential, but in patients without symptoms, this screening triggers one of the most dangerous cascades in all of medicine. A blockage gets identified. You're now referred to a vascular surgeon. The surgeon proposes a carotid endarterectomy. That's surgery to scrape plaque from your carotid artery. In patients beyond age 75, this operation carries a stroke risk of 3 to 5%. The very outcome you're attempting to avoid, the surgery itself can produce. The landmark ACST study found that in patients without symptoms, the benefit of carotid surgery was negligible in those beyond age 75. The surgical hazards essentially canceled out any potential gain. If you have no symptoms, no mini-strokes, no dizziness, no vision changes, a carotid screening might guide you down a road that ends worse than your starting point. Now, I don't want you to leave this video frightened of your doctor. That is absolutely not my goal. The goal is for you to become an informed patient. So here are the 4 questions every patient beyond 70 should be asking before consenting to any screening. The 4 questions protocol. Ask your doctor these. Question 1. What happens if I skip this test? Question 2. If the test discovers something, what would treatment look like for someone my age and health condition? Question 3. What dangers come with the follow-up procedures? Question 4. Is monitoring without intervention a reasonable alternative? These 4 questions will completely change every medical conversation you have moving forward. When testing is appropriate. And I want to be clear about something important. If you're experiencing symptoms, if something has shifted, if you're dealing with pain, bleeding, unexplained weight loss, new neurological symptoms, then testing is absolutely the right choice regardless of your age. Symptoms transform everything. This video is about routine screening when no symptoms are present. It's about the tests that get ordered because of your age, not because of any complaint you've raised. Your body at 70 isn't the same as your body at 50. The medical system has a duty to respect that difference, and now you have the knowledge to make sure it does. If this information could help someone you care about, please share this video with them, subscribe for more senior health content, and remember, the best medical decision is always an informed one. I'm Dr. Eric Sanat. Stay informed, stay healthy, and I'll see you in the next one.